All right. Welcome back, everybody. This is Billy with Harnessing Your Wealth, and we're going to continue on in our series with aspects related to health. Now, I know that many of you tune into the show and we're talking about financial matters and wealth because that's the name of the show, Harnessing Your Wealth. But one thing I've found in my life is if you don't have your health, then the wealth doesn't matter very much. And so we really dive into different subjects around health and the concepts that many people overlook or are misinformed about. And we're excited to have a guest today by the name of Dr. Brad Fanestil, who is on the show with us. And anyone who's out there listening who is currently undergoing any kind of chronic condition, whether it be pain or you have been labeled with a disease, you have a recurring problem or rotating problems in your body physically, if you have to wake up every morning and take 5 ibuprofen to get through the day, if you're having trouble with any physical component of your life, I think you really want to stay tuned and listen to this show. Dr. Fanestil is a board-certified internal medicine specialist. He's practiced as a primary care internist in Colorado for most of his career. For several years, he was the director of inpatient care at Avista Hospital in Louisville, working exclusively in hospitals and ICUs. In 2017, he began researching and learning about new theories in neuroscience, largely supported by functional MRI, and the data that came about from that. During that, he began to understand and explain that there may be emotional connections between the mind and the body. When he started to bring these new ideas to his primary care patients, many of his most complicated and frustrated patients starting to get better. He now runs the Boulder Institute for Mind-Body Medicine, where he teaches patients and clinicians how to use these tools to rewire the neural circuitry of anxiety and chronic pain in individual appointments and through online classes. So this is right in our wheelhouse, Dr. Fanestil. Heather and I talk about this stuff all the time. And by the way, I would be remiss if I didn't turn and introduce Heather, my wife, who has actually been on the show as a guest before, but she's joining me today to help host this show because she has a lot of questions and intrigue in this subject. So she's going to help me dive into picking your brain about all that you've learned. Thank you for joining us.
Yeah, thanks for having me. I'm so evangelistic about this that anybody who says you want to talk about what you're interested in, I'm like, yes, I want to talk about it. So I love to hear myself talk. So thanks for having me.
We love that. We're not going to be quiet on this show. We listened to your TED Talk and we were fascinated because one thing that struck me is you just make it so simple to understand. And you've been out there, many public speaking engagements. Will you give us a bit of a background on maybe how you stumbled onto this area of health and why it's so important, and like the awareness of the awakening that you had when you kind of moved away from the traditional mindset of you have to treat people physically and it's all a physical problem, and instead you started to look at the emotional component?
Right. Yeah. Yeah. It was an exciting exchange or exciting move for me to go from traditional internal medicine to really the last 6 years. I've been only doing mind body medicine. But the reason is because when I first learned about this, it was actually a patient came to me probably 8, 9 years ago. And he said, my back pain, I've known this guy for 10 years. And I've been holding his hand through chronic back pain. And then he said, I read this book and my back pain got better. And I'm like, what? You can't read a book and your back pain. I've been holding your hand for 10 years with this problem. And he said, well, I'm just telling you. So this was The Divided Mind by John Sarno. And at that point I said, I read Sarno's book called The Mind Body Prescription about 15 years ago. And I know right where it is on my basement shelf. And at the time I thought this guy's into something, but I was busy. I had 3 little kids. I owned my own practice. I had a business partner who was kind of going haywire, and I didn't have time to do anything with that. So I sat on my shelf. Now my kids were grown. I'm like, well, let me look into this. Anyway, a quick internet search, I ended up going to a weekend-long seminar in Santa Cruz, taught by Howard Schubner and Alan Gordon, and about these new concepts in mind-body medicine and curing chronic pain without drugs, just by changing your nervous system. Anyway, I came home from that weekend just going, holy crap, this explains 5 people a day in my medical practice. And before that, I just didn't know what to do about it. So I started using these tools right away. And within the first week, I was home from that thing. I had a couple of sort of miracle cures. Most people don't get better that quickly, but I had a couple of that did. And just by shifting what they were telling them, their brains. And anyway, this led me to more and more. And after a bunch of successes, I said, I'm quitting. I'm going to go do this different thing for the rest. I'm an old guy.
Wow.
I don't have a lot of hair left. What I have is white. And I've only got a few years left. I'm going to go do this thing because this is helping a ton of people that prior to this, I didn't know how to help.
It's so cool. And when you, it's like an awakening. I call it that because once you learn this, you can never go back to the old model, right?
Right. Once you see it, listen, I had a anesthesiologist who worked in Denver, and she called me, she's in her 40s or something. She called me up one day, this is a few years ago, 2-3 years ago. And she said, hey, can I come watch what you're doing for a day? Just come sit in on your office, shadow you. Because I had my own chronic pain problem. And so this is an MD anesthesiologist. She said, I got better using these tools. And I'm kind of thinking, I want to do something. Let me see what you're doing. So she comes and sees me. Anyway, we had a chance to talk. And she said, I work in the operating room. I knock people out, right? I go and I say, hey, I'm going to be your anesthesiologist. Here's what we're going to do. Here's your options, blah, blah, blah. I go their medical history, listen to their heart, whatever. And I did this to a guy just the other day. She's at a big hospital in Denver. And she said, I finished interviewing this patient. We're done. And I walked back to the doctor's lounge and I found the spine surgeon. And I said, are you sure you want to put this guy through his 3rd spine surgery?
My goodness.
And he looked me right in the eye and he said, well, you and I both know that back surgery for back pain has the same success rate as placebo. But what are we going to do? I can see problems on his MRI. I can at least make that look better. And it works 1/3 of the time, just like placebo does. And so, so it wasn't some nefarious thing by this spine surgeon. It's just like, this is the way our system is set up. But what she said to me at that time, she said, once I saw this, I can't unsee it. And I don't feel like it's authentic of me to go forward with my traditional medical career, just doing this. I've got to move over, which is why she wanted to come, see what I was doing. So
That's
you're right.
incredible. That's very rare to find a doctor who stays in their integrity of the truth and showing the truth, because there's not as much money to be made potentially, right?
Right. Yeah. There's a lot of incentives to, who was that? Upton Sinclair, who wrote the book, The Jungle, back in 1920. Yeah. It's very hard to get a man to understand something when his salary depends upon him not understanding it. Yeah.
No, it's true. And that's, I think that the big detractor is, and why so many doctors who step into this realm, like you have, are sometimes ridiculed or mocked or, laughed at as if, you're some kind of quack. Is you don't understand it because there's no science. You can't put a specific set of data on it because how do you measure a person's emotional state or their state of anxiety or stress, or so they just since they don't understand it, they just call it a sideshow. And doctors like Dr. Sarno and others who pioneered this movement and have actually seen thousands, if not tens of thousands or hundreds of thousands, over this amount of years, get better just because of the way they reprocessed their thinking and allowed their nervous system to reset. And they realized that it wasn't the physical abnormality that was causing the pain, which is what we've all been led to believe. Yeah. It's so hard for people to get that put in their mind, to actually believe that.
Yeah, so many people are stuck with the bone on bone, and I have bulging discs, and my doctor says, and it's very hard to sway people out of that belief and into maybe addressing their emotional, standpoint on things that have happened in their life, where they're at, with
Right.
their responsibility and things that might be playing a much bigger part in their pain.
Right. So the reason I'm optimistic that this is, although for the last 6 years, 6+ years that I've been doing only this, every year I'm like, oh, we're going to get a breakthrough this year. It's busting loose, these ideas. And it's always slower than I think. This change in we're in a paradigm shift here. But the exciting thing to me is that we do now have a different understanding of the brain and neuroscience than we had 20 years ago, that I'm really hopeful is going to allow traditional Western medicine doctors to adopt these ideas without calling them woo-woo. And by going, hey, there's actually neuroscience behind this. I may not have been trained in exactly how to use that and what to do. I'm trained in, doing my surgical skills or knowing the physiology of the body and treating. I'm trained in treating you like a car. And there are a lot of times when I want to be treated like it. I mean, if I have appendicitis, yes, please. Go ahead, put me on the table, knock me out, and do what you need to do. And that's true for a lot of things. If I have a heart attack, get a stent in my coronary artery, I'm going to give up my agency to somebody who knows what the hell they're doing and let them fix me. That's a super appropriate. It's a great model. It's the model that Western medicine's based on. It just doesn't work for about a third of what walks into a primary care office. So we need to take the, well, I now tell doctors, if you're operating on the model that, and I show a little picture, there's a picture that Descartes drew in one of his essays. He said, I think, therefore I am. That's what he's most famous for. But in one of his essays back in like the 1700s, he has a little picture of a man with his foot in the fire. And he drew a little line going up from the foot up to the brain. And he says, well, the reason we feel pain when our foot's in a fire is because we have a brain. Now, he wasn't wrong about that, but he only had half the story. What we now know, and these circuits have been defined, is that, yes, a signal goes up to the brain, and then the brain does a whole bunch of stuff and sends a signal back down the spinal cord right to these nerves that are coming in from the foot. And these nerves, again, these circuits have been identified. There's a connection. It's called the downward pain cycle circuit. It's not very imaginatively named, but it actually goes down and it intersects with the upcoming signal in your midbrain, in your spinal cord, and even right at the foot there as the nerve that's sensing this fire or whatever it's sensing, it's getting a signal from the brain telling that nerve, go ahead and fire harder. Or, oh, wait, it's not really in a fire, you can relax. But our brain takes control of what's going on. So pain, what we now know, again, based on absolute, just documented neuroscience, is pain is a two-way street. Yes, there's input coming in. Then your brain, based on its expectations, its own experiences, the mood that you're in at the time, your attention, does things to the incoming input. And this is, again, one of the big new theories in neuroscience, the idea of predictive coding or predictive processing, that we're all living in our own brain's controlled hallucination of the world. Now that sounds like what are you talking about? I mean, how does that help me? But it looks like what our brains are is amazing predicting machines. So an example, if I'm walking on a wooden deck and I step on a splinter, a message goes from my foot to my spinal cord to my brain, which says, oh, I just got a message of danger in the foot. Tiny, sharp wooden deck, that's a splinter. Should I bring this to Brad's conscious level of awareness? Yes, I hate splinters. And before I take my next step, I'm hopping and pulling a splinter out of my foot. But if I'm walking on the same deck and I step on the same splinter, but this time I'm involved in mortal combat, all the neurons still work. And a message still goes from my foot to my spinal cord to my brain, which says, I just got a message of danger in the foot. Tiny, sharp wooden deck, that's a splinter. Should I bring this to Brad's conscious level of awareness? Not right now. And I finish my mortal combat, which I win. And it's only 5-10 minutes later during recovery that I kind of finally start noticing, whoa, wait a minute, what's going on? When did that happen? That was a decision by my brain to not bring this to my attention. Thank you, brain, good idea. But the important thing to understand is that doesn't just happen during an adrenaline rush. This is how brains work. They take in input, they feed us back what we need to know. Sometimes brains make mistakes. Sometimes brains get into habits or patterns of behavior. And this is all happening below your level of awareness. Very important to understand that there's something running you that isn't something you can control. It's your autonomic nervous system, your primitive part of your brain. It's a very big part of your brain that runs your body completely outside of your conscious awareness. I'll shut up for a minute.
Oh. That's a great background and to provide us with the scientific part of it.
Yeah.
Most people just, when I was going through, I'll just maybe use myself as an example. I was in pain, drastic, severe, debilitating pain. It changed my identity, who I was, what I was all about. It becomes the most important thing in your life, right? You have to almost give up everything else that you want to do. And you're always focusing on it. The pain takes your attention and it runs with it because now you're fearing it. And the pain is always there nagging at you, or it's playing with your mind as far as how bad is it? What am I going to do? What's my life going to look like? Researching it, digging deeper. What's wrong with me? What specialist should I go to? Always open to different ideas or thoughts or treatments, and basically getting sold down the river with thousands of different treatments or cures, so to speak.
Yep.
But what do you tell people you meet with of how to maybe stop? Because I remember being in that mindset of how do you stop and deal with it in a different way and stop thinking about the pain, because it is there and it's so hard to not think about it physically.
Mhm.
How do you change your mindset after maybe doing that for years and years and believing in all the doctors that have told you have a physical problem?
Yeah. It's not always easy. I mean, a lot of times people are coming in with, as you say, dozens of doctors and other clinicians, physical therapists, whoever has seen them, giving them one narrative that it's your discs in your back, or it's your this or your that, or nobody could find it until the 17th doctor did a more esoteric test, and we found a slight problem in your magnesium level, or they come up with some, if you do enough tests, you're going to find something.
Sure.
5% of all medical testing in totally healthy people is abnormal. That's just the way everything's on a bell curve, and we do a bell curve at 10,000 healthy Army recruits and lop off the top 2.5% and the bottom 2.5%. And we call everything between the 2.5 and 97% percentile normal. These people are totally healthy. They just are one end of the biologic bell curve. But so anyway, if you test enough things, you're going to find some abnormals. And so we are fighting against, a lot of times we're fighting against this entire inertia of the healthcare system that isn't seeing things the same way. So a lot of times people have to get to a sort of desperate point. They're like, I am so far, I'm going to listen to, my mother told me about you 2 years ago. I hear this all the time. My friend told me 2 years ago, or I've had 3 different people mention your name over the last 4 years. And finally, the third one last week, I said, that's it. I'm going to go talk to this guy. Why didn't you listen 4 years ago or 2 years ago? They just weren't ready. And they were using their coping skills to get through the day. And most of them got through the day, but that didn't get rid of their pain. And they were getting through their day with misery. And I think that a lot of it, so I can go down a couple of paths here, but I just want to get in the point here that what we're talking about when we're talking about mind-body medicine has nothing to do with coping skills. Most of the people I see with chronic pain, chronic anxiety, have coping skills out the wazoo. They drag their ass out of bed, no matter, they're miserable, and they drag their ass out of bed every day, and they go take care of their mother or their kids, or they go to work, or they take care of their dog, whatever the heck their thing is, they do it. They could come teach coping to a lot of my other patients. This has nothing to do with coping. Coping happens up here. You can suck it up and cope. And again, so many people I see, they are the world's best sucker uppers. They know how to do that. That's a great skill. It's a great coping skill. Keep it. I think that's fine. It'll get you through the day, but it's not going to change the brain circuits. I'm talking about rewiring these circuits so you don't have to cope with them anymore. And that is a different set of skills than, come on, can't you figure out how to suck it up? Sucking it up does not work. Again, it'll get you through the day. It won't change your pain.
So someone comes into you as a patient and they're suffering chronic pain for, quite some time. What is your first, action step for them when there's nothing wrong with their MRI? They've run all the tests and everything comes back normal. What would be your first step?
So the first step is education, that they have to understand how their brain works, because I don't fix anybody. I just show you how your brain works and give you some tools to rewire it. Mm-hmm. So the first step, a lot of the time I listen to some of the story, and then I'm like, can I just show you a way of thinking about this, how your brain works, and see if it makes sense to you? And if it doesn't make sense to you, then I would advise don't see me again. I'm not going to, yeah, again, I'm not going to fix you. You're going to do it. And if you don't think I'm making any sense, then I'm not making any sense for you. I sort of operate with two foundational beliefs here. One, the human body is an amazing healing machine. I have seen people literally crawl off deathbeds. Two, you have your own innate wisdom about what's right for you. And you should listen to it. And if you listen to me and you think that's a bunch of BS, or maybe I'm sure he helps some people, that's not for me, then it's not for you. Go back and keep pursuing these other avenues. Maybe you haven't pursued enough of them yet. The truth is that most people come to see me, they've done their due diligence, and they've done it all over the place. They've done it in spades. So many people who come to me, they're like, okay, yeah, I'll listen to anything. So sometimes I don't have a huge hurdle to at least get them to listen. And then the first thing I like to tell them then, though, is let me just show you how your brain works. And I show them something, and I'm happy to review it in just a brief little, it takes about 3 minutes for me to walk through that. It's what I show in my TED Talk. And then I ask them, does this make sense to you? The way I'm describing it. And 99% of the people who come in are like, yes. And probably 90% of them are like, yeah, that's the first time anybody's explained it in a way that really made sense. And so explaining how brains work is a very important first step for most people, and explaining in a way that they can get it fairly quickly without doing, hours of reading or something like that. So anyway, that's step one, is just showing them, and do you agree with that? And if you don't agree with that, let's talk about that. Why doesn't that make sense to you? So I'm happy to talk about, in a nutshell, the new neuroscience of pain. But
there are so many great doctors out there who are looking into those things, and trying to get the science behind it, because as we know, the medical industry is very reluctant to adopt anything unless it can be proven in a lab, so to speak, or this drug compound does that. And we're always just looking at the physical component of health, and not really getting into this, what does the mind do? How does the mind belong here? So the doctors I follow, and I'm sure you have a number of doctors that have made sense to you, but Andrew Weil, Herbert Benson, Deepak Chopra, and then there's those who are not necessarily doctors, but have stumbled across it and are doing something. They're kind of carrying the torch, so to speak, and we're getting awareness in the form of documentaries or movies, YouTube videos, and then there are a lot of people out there who are posting things about their healing, and thousands, which is what it took for me, because I'm a black and white type mindset. I have to see it. There's no gray area. Prove it to me, So I was going through my struggles. Heather's over here telling me, look, this is your problem. Read these books. You're constant a ball of anxiety or worrying about everything all the time. But that doesn't click to me, because that was my normal state of being. My whole life was just to be always tense, always looking
completely unaware that
danger.
he was even in that mode.
Yeah.
It took me a while. And then even with reading the books, I would start into that, and then I would fall right back to the medical model, because this doctor told me I had a disease. You did a blood test. They did a body scan. They did an MRI. I've got all these results. So it really took me a lot more time to change the way I thought about it, and to let go of all those things. And now I would love to go visit with all those doctors and just say, you know what? Everything that you told me was absolutely dead ass wrong. That's what I want to say. But maybe that time will come. I'm just glad that people like you are out there doing what you're doing.
But I think it took a lot of repetition for you to calm your stress response. All the meditation you did, you were aware that when you would exercise, run, be on the farm with the horses, you weren't in pain. And so I think it took, I'm not in pain when I'm enjoying life. I'm in pain when I'm in stress, and you correlate the two. And then you start to have a little more trust, and there might be something here. And that one thing leads to another for most people in that respect.
Yeah, sometimes one of the very early exercises that I'd like to leave people with, even at just the very beginning, when I've given them a brief little explanation about how their brain works, and they're still like, I don't know, I'm at least open-minded enough that I sat here and listened to you, but I'm still, it's unusual. I tell people, I can send you out of my office after one visit, I got white hair and I can tell I worked in ICUs. And, the doctors are I like to say that our current religion is science and doctors are the shamans. And I'm embracing that. I mean, let me take that power. Yes, I do have a lot of experience, and I'm going to tell you what I think pretty authoritatively, hopefully kindly, and in a way that I'm also listening to you. But doctors have real power when they tell you something. And so I can often leave people at the end of the first visit with, see, and they're like, oh, this makes sense. I get it. Okay, this is exciting. But I tell people, all right, you're going out of here feeling like you got a little bit of a beginning of a plan, and you're going to go look at some stuff, going out here for the first time, maybe in years, with a little bit of hope. You're letting that door open a little bit. I applaud you for being skeptical still. If you're not skeptical, you're not thinking, because this is the first time you've heard this, but at least the door is opening up. Great. But I'm going to tell you, tomorrow morning, when you wake up and your back is killing you, or your headache or whatever has brought you in here, this is all going to go out the window. And you're going to go, well, that sounded good in his office. It doesn't sound good today. So to your point, Heather, this is a process of repetition. This is a different way of thinking and a different way of understanding. It's the new neuroscience way of understanding the brain, but it's different than what we grew up in, that my brain works like this, or my body works like this, and this is how it is. And if I want to change that, I need a drug to block a chemical receptor, or I need a procedure to do this. And again, there are great times for drugs and procedures, usually in more acute settings. For most of these chronic illnesses that nobody can quite figure out, or that have 3 different diagnoses or 7 different diagnoses, a lot of the things I see, the diagnosis the person walks in with depends more on which doctor they saw than what scan or blood test showed. So those kind of things, though, need to be treated differently. And they do need, because it's a different way of thinking, you need to hear it over again. And I had people just this morning, I saw a guy and he's like, I've seen him, he took my class, that's 6 sessions. He's seen me twice before on just, these are over the last few months, because I don't see people that often. I'm like, here, I'm gonna give you some stuff to do, see you in a month. You do the work here. But anyway, just me repeating some of these things, he's like, and I'm thinking, I've said this to you 5 times. And he's like, oh, he actually said, it does me so much good to hear you say that again. And that's right. Yes, I know that's right. And I knew it was right a month ago, but I sort of forgotten that that was right. But yes, so
Yeah.
we do need to hear it. Oh.
Yeah, I see that a lot with clients I work with. It's switching the neurons in the brain from fear to courage. Then they're back in fear. Then that courage stays a little longer. And so you're on this scale of, this is what you're on. And the fear's a little bit longer than the courage. And then the courage starts to take over and dominate over the fear. And so it's just encouraging, and it helps when you're a doctor and you have the white coat and to say, yes, this is correct. And this is an abnormality on an MRI, right? And so that authority steps in and, creates the placebo effect.
Yeah. So I'm very hopeful that, as the years go by, and as this, because we are starting to get actual medical literature articles about using these tools for chronic pain, and for some emotional, like PTSD. There's a fantastic study out of UCLA a year ago that I can talk briefly about if you want to. But anyway, we're starting to get real respected, peer-reviewed articles in major medical journals saying that this works. And I know, just based on who I talk to and what's happening, we're going to get more of these over the next few years, enough that, and that's super helpful when I go talk to doctors. I can spew, you got any studies on this? They want to see it. And that's great. I mean, I like that. I respect that. That's why why Western medicine is so powerful. And it is based on not just anecdote. It's based on the scientific method and doing studies. And right now in this particular field, we have a small handful of studies. I'm just not, and so I can see why some other docs like, that's interesting. And I know you, and I know you're like not a wacko. I mean, I worked with you in the hospital for 30 years. And so I may in my own community or something have a little more cred, or people will listen to me, but getting the generic doctorhood to listen, yeah, we need those studies. But there are real neuroscientists. There's an organization called the Association for the Treatment of Neuroplastic Symptoms. And that's sort of the term that's come up recently, started using the term neuroplastic to mean brain generated or brain augmented symptoms. But I went to that last year. It's actually in Boulder. It's going to be in Boulder again this year. It's in September. And the Friday is a 3-day conference. And Friday was all neuroscientists, the first day of the conference. There's a guy from University of Haifa in Israel. There's a guy from Yale. There's a guy from UCLA. There's a guy from Colorado University, a couple other places. But these are guys coming in, and they're not even doctors. Well, some of them were doctors, but a lot of them were just PhD neuroscientists saying, hey, this is how the brain works, and it makes sense for it. So as that, starts to permeate our scientific literature, I'm super hopeful that Western medicine is going to say, okay, I saw this happen with cognitive behavioral therapy, it's a different kind of thing. But I just remember in the 90s, the studies actually came out that said, this seems to actually have some well done studies that say this works, at least, percentage wise, for more people than some other versions of psychotherapy. And don't mean to hold CBT up as the be all and end all. I think it's a form that can help some people. But when that comes out, I can remember at my primary care clinic, other doctors going, wow, do you see that article and this thing? Okay, I'm going to suggest my patient with depression or whatever, try this. So doctors will take new stuff, but we do need the science. And as I say, the science is starting to happen. So I'm not surprised that they're not all glomming onto this, although there is always a part of me like, can't you guys see this? It's so obvious. But,
Yeah, you want to shout it. You want to go out there and scream because so many people day to day are missing the boat. I talk to clients on a weekly basis, and it never fails. We ask them how they're doing, what's going on. And I would say 75% of the time clients are telling us they have some kind of health problem, or, I'm going in for a new knee, or, I've got to have a new hip put in, shoulder surgery, I'm dealing with back pain. I've got this problem or that. I mean, it's very common. And I don't know the numbers. Well, I have the numbers, but I don't have them with me. The number of Americans who are on one or more medications is staggering. And the healthcare industry is predominantly ran by pharmaceutical companies, which I think the system is kind of set up wrong. If I can just say that word to be direct, is the incentives and the motivations feed right back to the profiteers, rather than, like we talked earlier, having a doctor who looks at the whole person and with convincing fashion and words that resonate, say, you're just fine and you're going to be fine. And here's how you're going to get better, rather than the maybe this, maybe that. You have a physical problem, you have this, and we don't know if there's any cure, but these drugs will help you cope.
Yeah.
That's the frustrating part.
Yeah, there's an amazing power. In fact, when I lecture to physicians, one of the things I always say is that, you've got your now hypothetical little black bag of tools, but you need to remember one of the most important tools in your little toolkit. It's called reassurance. Mm-hmm. Super helpful. When somebody, again, the shaman of the community who knows what he's doing, has legit experience, has steered you right before maybe with your sinus infection or your pneumonia in the hospital or whatever, it comes out and says, hey, I think we're going to do okay here. You pick up the phone if you're not getting better, but I think we're going to be okay. That level of reassurance is super helpful, because what you tell yourself about what's happening to you impacts how your autonomic nervous system, which runs your body outside of your conscious awareness, this is a real part of your brain, by the way. This is not a theoretical construct, but what you tell yourself impacts how this non-thinking part of your brain, the autopilot part of your brain, the autonomic nervous system, how it reacts to the world. And if you're telling yourself you're sick, then everything you do, from meditation to breathing exercise, all of that just becomes a Band-Aid on, let me fix my broken self. And so the changing of the narrative, and I don't want to BS people. I tell people, I don't want to take off a 30-year internal medicine hat and tell you that we should be treating your fatigue with, mind-body tools. And then I find out 3 months later you have cancer and nobody did the right test. I'm a huge fan of due diligence. But again, most of the people I've seen have done due diligence in spades. And so I can look at that and go, okay, I'm confident here. This is the thing. But if I'm not confident, I'm not going to go forward this. I absolutely have seen people who come in. I'm remembering a woman not too long ago who came in. She's like 38. She has 2 kids who are, relatively young kids. And she's got this abdominal pain. And she's like, I think it's a mind-body thing. I've been reading, and she's a nurse. And she's been reading. And I'm like, you know what? The way you describe it, I think it's a mind-body thing too. But there's no way in hell I'm going to let a 38-year-old mother of 2 with an abdominal pain that is a little sketchy. Granted, you don't have weight loss or anything super worrisome, but you've had it this long and you haven't done a single test. I'm not going to go down this route until for my own reassurance. So there are times you need to do this. But again, if you're somebody you've seen a bunch of doctors, you've had a bunch of tests, you're getting conflicting advice, or this guy says this, yeah, this guy says that, or they found maybe they're saying, hey, you have this, and yet the treatments don't work. There's usually a huge component of your central nervous system keeping this pain going.
Right. Let's get into that rabbit hole a little bit. We talked about this all the time, because even the dreaded diseases that everyone's so terrified of contracting, like cancer or MS or whatever is considered to be life-ending or altering in a drastic way, we talk about that. And we've gone to Dr. Joe Dispenza's conferences, his multi-day retreats, and seen and heard from people, the testimonies, people coming on stage who have healed from stage 4 cancer, for example, and just by a change of their mindset and their energy. And, they kind of went away from those traditional forms of treatment, which, as we know, are the standard. They're the accepted practice in cancer treatment nowadays, chemotherapy, etc. But there are some serious side effects of those, and for many, they don't work. So more and more of these studies are coming out, and more stories are coming out of permanent healing from folks who went a different route. So, Heather, what are your thoughts?
I have a lot of thoughts on that, because I see people daily, weekly, and I've experienced a lot of people overcoming all kinds of conditions, people coming off of disability, getting their lives back, people wheelchair bound, and they're out hiking mountains, and their quality of life is back. And I know for Billy and I, we thought, how does 2 perfectly healthy people suddenly nosedive with their health? I had chronic fatigue, I had adrenal problems, I had chronic migraines, vertigo, female issues, and it didn't make any sense to me, because I'd always been a healthy person my whole life. And same with Billy, we were very active and running and doing all sorts of things. And I see this all the time, and people's health just takes a total nosedive. And so I think it's the curiosity behind what's going on in your world that really makes the difference. Because if you have zero awareness of what's going on in your life, how can you make a change? How can you propel yourself forward? How can you overcome something that you don't even know is there? And so for us, I think we really did a lot of investigating and seeing what's hard for us, what's keeping our cortisol response so elevated and out of whack, and what do we need to do to flip this switch? And for me, it was finally feeling validated. And man, this is a hard season of life. It's the age of responsibility. And I've listened to several of your YouTubes, and you talk about a lot of people coming in, 40 years old, they've got all these deteriorations and spine this and knee that, and the neck pain is chronic. And why is that? People are starting to wonder, why at 40 years old is your health just suddenly take a nosedive? And I think the bigger thing that people need to realize is this is the age of responsibility. You've got mortgages, you've got kids, you've got a million different activities, you've got perfectionistic tendencies, high achiever. I mean, there's so many pots in this fire that you don't even know are burning, and your house is burning down, and you're like, can you just give me a pill for this? And that's not going to solve the problem. So I think that would be such an interesting thing for people to take a look back at. What is the root, and not what can I do to just, cater to this symptom for today? What is the root? Why is this keep coming back? Because you can treat it for a day, but tomorrow morning you're going to wake up and you're going to be in back pain. You're going to have fatigue, whatever your symptom is. Why not take a deeper look at why it's coming up, and how can we overcome it? Not just, cure it for a day.
Yeah. And a lot of people are, again, the best copers are often the ones reluctant to do that, because they're like, well, other people have kids and other people are in a busy part of their life and they don't have this. Well, I'm here to tell you, as a primary care doc, even before I got into this, just as people came in for physicals, the high percentage of people who come in who are ostensibly healthy, and they are. They weren't on a bunch of meds even, but when they're coming in to tell me how things are going, I'm hearing about it. And they go back out into the world, and very few people know that they have their chronic problem. These people aren't whiners. They're the furthest thing from whiner in the world. Maybe the people close to them, their partner, their family knows that occasionally they have to take time off or they have to cancel an event or something because of it. But most of their world doesn't even know this. So those are the people who are, they're so good at sucking it up. They think that I'll just use that to get through this. And that's fine if that's working for you, but I'm just saying there's another way. So just as you were talking, Heather, it made me think about what do you tell people who are still trying to figure this out? In addition to some education about here's how your brain works, which I love to talk about, and I've got a little 1-paragraph spiel I'd love to give you. But in addition, I tell people, why don't you try you don't have to know anything, you don't have to believe anything about this yet. Can you just try this over the next week or two? Next time you're going through your day and you don't have any pain, you're typing an email, you're talking on the phone, you're walking the dog, and there's no pain. The pain's probably there. If you turn and look, there it is, but it wasn't front and center. And all of a sudden, it becomes front and center. Right at that moment, instead of going, oh, what pillow did I use last night? Or, oh, I walked too far yesterday. Oh, I bet it was emptying the dishwasher this morning, that repetitive motion. Instead of any of that, turn around and look inside and ask yourself, what was I just thinking or feeling? Many people are surprised to notice that right when the pain comes to your attention, I was just telling myself what an idiot I am for forgetting such and such, or I was just worrying about my daughter. And you don't have to do anything with that. We're not psychoanalyzing this. You're just noticing, is there a relationship between, I call this the under the hood exercise, between what's going on under the hood and the boom, the time when pain first comes to your attention. Not true in everybody, but it's true in a surprising number of people. And it's an interesting little simple exercise that you don't have to have read anything or educated yourself first. It's part of the education. People start noticing, oh, crap, because we're all talking to ourselves all day long. And just point out, it's like, oh, I just had pain. Let me see what I was telling myself. Very frequently, it's something negative. And people start to make that association. It helps them just start to understand, maybe there is an association between what's going on under my hood and my pain.
Yeah. I use that often with my clients and actually with our kids quite a bit because, they'll have a headache or a stomach ache. And instead of giving them ibuprofen or some pill, I say, what happened today at school? What sucks?
I love it.
And so we address the underlying issue. I always ask what sucks because everybody's going to know what sucks. They're not going to know what they were just thinking. For most people, they're completely unaware, but my kids always are going to tell me what sucks and most adults as well. And so if we can, get that one thing that stands out the most, that's probably consuming the bulk of your thinking. And then you can address how that makes you feel in your body. Most people are unaware of what they even feel in their body, right?
Yeah.
We go in to take a test in high school and we're unprepared for the test. We might be, have a rumbly stomach or a racing heart or a headache or something because we're not prepared. But I see so often in my adult clients that I work with, when I ask them, when you think that thought, where do you feel it in your body? And they say, in my mind.
Right.
And I'm like, then I know, okay, they're completely detached from feeling anything in their body. They're always just using their mind and their thoughts. And so then I say, no, I want you to close your eyes and put your hand on your heart and just breathe for a minute. And then I want you to think that thought and then tell me where it's at in your body. And it always is, the chest or the stomach, And so I think people really are not in tune with how the mind correlates with the body. And that's such a key component.
Mm-hmm.
Yeah. And I love that. That makes me think about, I use this, I was doing this for about a year or two when I realized, wait a minute, these same ideas work for anxiety. So now when somebody comes to see me for anxiety, because pain and anxiety, we're starting to understand them both now as alarms from your brain to protect you. So, the old neuroscience was that your body sent your brain a pain signal. Your brain said, thank you for the pain signal. I'll go get my heating pad. But the new neuroscience suggests that, well, yeah, your body sends signals to the brain, but it's the brain that makes the decision. Is that signal dangerous? And if your brain decides the signal is dangerous, then the brain warns you by creating pain. So pain is a protective mechanism. If I'm running and I break my ankle, I want pain. So I now think all pain is in the brain. And when I say all pain, I mean all. I mean, when my hand's on a hot stove, message goes fingertip, spinal cord, danger alarm center, my subconscious brain, which is always looking out for me. And it says, oh, message like that from the fingertips, that's tissue damage coming my way. I better run an alarm. And my brain runs an alarm called finger pain, meaning it turns on some pain neurons. I take my hand off the stove. Now, that'll happen a split second outside of my conscious awareness, but it's the brain that made the decision correctly that I was in trouble. It's the brain that made the decision correctly to turn on the pain alarm to get me out of trouble. So I now think of pain as nothing more than my brain's alarm mechanism to let me know I'm in danger. My brain thinks I'm in danger. It activates certain neural circuits to create for me the experience of pain, to get me out of the situation. Anxiety works the same way. If I'm in a dark alley at night and I hear footsteps, I want anxiety. Yes, please. It's called the fight or flight response. A lot of stuff happens in my body. My muscles tense up. Doesn't feel very good, but it helps them react more quickly when they're already tense. My heart pounds through my chest. Doesn't feel very good, but I need to pump some blood for fight or flight. My stomach gets queasy. Doesn't feel very good. That's my autonomic nervous system shunting blood away from my stomach and intestines. I don't need to digest food right now, towards my large muscle groups for fight or flight. And my brain up here, my autonomic nervous system, my primitive survival brain is kind of going, you know what else we need? More oxygen. Because fight or flight, we got to get some more oxygen going to the tissues. I need you to breathe faster. I'm a primitive part of your brain. I often call it the lizard brain. I don't speak English. I can't say breathe faster. I don't even have words, but I do control the body. You know what I'm going to do to make it give us more oxygen? I'm going to make you feel short of breath. I'm going to give you some chest tightness. That's going to do it. Now, if I'm in that dark alley at night and I turn to my lizard brain and I say, what the hell are you doing to me here? I feel like crap. My muscles are tense. My heart's pounding through my chest. I'm nauseated and I'm short of breath. Could you stop this, please? If it could talk back to me, my lizard brain, if it could talk back, it would say, I don't give a crap how you feel, dude. I'm not trying to make you feel good. I'm trying to save our life here. This is how I work. I'm making you feel bad to get us out of a situation. So we're starting to understand both pain and anxiety as protective alarms from the brain to the body. Now, yours may be running more than you want. That's a problem. But it's the reason that they're not these aren't a disease or a disorder. You know, appendicitis is a disorder. You go see the doctor. Diabetes, you got, maybe there's some pills, maybe you need insulin if you're type 1 diabetes. There's things that are disorders out there, but not everybody on the planet has appendicitis or diabetes or a heart attack. Everybody on the planet has had pain and anxiety. If you've never had anxiety, you're dead now. Your brain didn't get you out of a situation. So I'm just stressing, I'm not trying to minimize the effects or even the disabling effects sometimes of anxiety or chronic pain, but I am saying that at root cause, they're not diseases. They are neural circuits that are running more than you like. And the good news about that is with the new neuroscience, all neural circuits can change. It's called neuroplasticity. So when we turn our attention from the body to the brain, we have a new access point to treat chronic pain. And likewise, it's kind of an oxymoronic thing for anxiety. I asked, and this is what made me go down this ramp. Heather, you were talking about this whole, I love the fact that you're like, asking people, where do you feel that? And even the people who say, I don't feel it. I ask everybody with anxiety, what does it feel like to you in your body? And most can tell me, I got this or that, but you're right. There's I don't know, 1 out of 20, 1 out of 10 people will go, I didn't come in for any of this stuff. I came in for anxiety. It's right here. I got a lot of stuff going on up here. And I'm like, okay, let me rephrase the question. The negative thought cycle that you're having, the worry spiral, the OCD thinking, the thoughts that are brought in here. How do those make you feel? I have never had anybody tell me, I feel fine. I want to get rid of the thoughts. I've never heard that. They're in the doctor's office because they feel like crap and you can't fix what you're not looking at. So we look at the physical sensations of anxiety and we start getting out of this cycle that we're in by watching them differently. Instead of, we don't run away from them. That's just another fear message. We don't say, oh my God, I got anxiety, I got away from it. That's what Western medicine is doing. And I mean, we do need to get away from it at times. At times, that's a right response. I got to get through my day. But if you want to change it, you go towards it and you notice what's happening and you do something different with it other than, I can't deal with that right now.
And the big thing is stop fearing it, right?
Correct.
I love that because it's fascinating to watch Western medicine. I see so many teenagers in my community, especially, the moms have all these teenagers, my friends, they bring me their teenagers and they said they've got anxiety. Everybody has anxiety. Everybody has social this, social that. What, you know, should I medicate them or what should I do? And I said, that is the worst thing you can do is to medicate your teenager because they're going to have to deal with that at some point in time. They're going to have to address the uncomfortable emotions that they're resisting rather than taking a pill. I was on anxiety medication for several years because I would rather feel numb than actually deal with what was hard. And then eventually, you know, I learned about the mind-body connection. I decided I no longer need to subscribe to any of these pills I'm taking. I've not been taking pills for 10 years now of any sort, and I trust the body. But when I decided to go off the anxiety medication, it was like a raw, open wound that I had to fill for the first time. And so you medicate these young teenagers. You think you're doing them as you know, a good, a solid thing here, but what you're really doing is you're prolonging their pain to be addressed at another time. And so I feel like you saying anxiety is normal. Anxiety is trying to say you have stuff going on in here that needs to be addressed instead of running away from it. So thank you for sharing that.
Well, I love that you're doing this with kids because this is not rocket science. We should all know these tools. We should be teaching these tools of self-regulation and self-awareness. You can teach this to first graders. You can teach mindfulness in a different way, but you can teach the idea of watching what their own body's doing and what their own mind is doing. You can teach these to young kids, and you're teaching it at a different level. But I always say we should be teaching this in kindergarten. We should be teaching it in middle school health classes because we're teaching people now that you have a disease or a disorder, and then that gets into your head for years and years. And now, oh, I have anxiety. Of course you do. It's called being human. And again, this is a nuanced discussion because I don't want to minimize how bad it can get. In my 30-year medical career, now 35, whatever, just as a primary care doc, unfortunately, just as a primary care doc, I saw some people commit suicide, and I had heard their stories in my office ahead of time, not necessarily the day before. Most of them had other health care or mental health care along the way, but whatever. But I think I'm confident I saw more suicides among people who had been diagnosed with anxiety than with depression. Anxiety can be very disabling and it feels so bad. So again, I don't want to minimize it. And sometimes people, what we've moved from is, and this is good, we've moved away largely in the biomedical world, away from the blame the person diagnosis. Oh, you have anxiety, you just need to suck it up. And we've said disease. I kind of like the new model better, the disease. At least it takes the blame off this person. But it puts them in a different category where it also takes their agency away. And now their agency is in my hands, and I've got you right where I want you as part of the biomedical complex. Oh, good. A patient. Okay. I got all sorts of stuff.
For life, right? Now you've got them in the system.
Right. So this is a nuanced thing because the old model wasn't right either, because it's important to understand that the neural circuits I'm talking about when I say that we're starting to understand pain and anxiety as protective alarms, these are learned neural circuits. And they are learned by most of my patients. As I say, this is a protective alarm. Most of the chronic pain and the chronic anxiety I see is due to what I view as a hypervigilant danger alarm mechanism. And as I say those words, most people who see me, the vast majority are like, they know what I'm talking about. Yeah, they've got and these are circuits that developed outside of your conscious awareness. You did not make this happen. Your brain got hypervigilant, usually for very good reasons. It was kind of useful to be a little hypervigilant. And brains that do things over and over, neurons that fire together, wire together. Nice rhyming phrase, comes from the neuroscientists. If you've practiced walking on eggshells because somebody in your family when you were a kid was a rageaholic or whatever, your brain got good. It wired together some hypervigilant circuits. The important thing to understand, though, when I say these are circuits in your brain, these circuits developed outside of your conscious awareness. And it's a very important message for everybody to hear who's dealing with this. Not your fault. Super important part of getting better. You can't blame yourself for this. You had nothing to do with it. This is your primitive survival brain doing some things and it's just gotten stuck in hyperprotective mode. So
Mhm.
instead of yelling at it, you can yell at it all you want. And again, I like to tell people, can you step back and see what your brain is doing and notice, oh, there's that primitive survival brain trying to protect me. I see what you're doing. And then you want to bring, while you're talking to your brain, I like to say that most of my successful patients start getting better by talking to their own brain. I have a guy who named his brain George. Whenever his back pain wells up, or his anxiety, he has both. He can't control them. This is an autonomic nervous system putting tension in his body. But either time he steps back and he says, George, I see what you're doing. This is super helpful to him. Helps him realize this isn't him. He doesn't want it. No part of him wants it. It's his primitive survival brain running some circuits, again, that developed outside of his conscious awareness. So as you talk to your brain, though, stepping back is step one. Oh, I see what you're doing. But then the energy that you want to bring to your brain while you're watching what these old ingrained circuits are doing, if you want to change them, you don't yell at them. You yell at them and they just go, I know, I shouldn't be doing this. You're just putting more fear into them and keeping it hypervigilant. You want to take the attitude you want to bring to your brain is the same attitude you would bring to a scared child. Because your autonomic nervous system is just like a scared child. For one thing, it's scared in all of us. That's its job, to be scared for me. To jump out of the way of the onrushing car before my neocortex even knew the car was there. If it's working properly, it's scared for you. And it's childlike because it doesn't see the big picture. It sees all your past experiences, habits, or patterns of behavior that seem to have kept you alive. That's my only job as the autonomic nervous system. I think I'll just stay like this. So we want to bring at this. How do you talk to a scared child? You yell at it? You tell it to shut the hell up? You tell it, I can't deal with you right now? No. You go towards the child. You put your arm around her and you say, I was scared of shadows when I was 4 too. I know what you're going through, but it's okay. And you have this different kind of energy. And as you do that, the brain kind of goes, what? I thought whenever I got like this, usually you used to yell at me when I got like this. You told me, or you told me to suck it up. Oh, come on, you stupid 4-year-old scared of a shadow. You wouldn't do this to a kid. You wouldn't do it to a child. So I like to say that when a child is scared, we get tears and behavior problems. When a brain is scared, we get tension in the body. Most of us have spent our entire lives dealing with our anxiety, our chronic pain, whatever, doing the exact thing you would never do to a scared child. We've been telling it to suck it up. We've been telling it, oh, come on, you wimp. Or we've been telling it, I can't deal with you right now. All gets you through the next 10 minutes, doesn't calm down the child. So this different attitude, I see what's happening. And, I can't make a child stop crying. In fact, sometimes the harder I try, the worse it gets. Stop crying. That doesn't help. It just makes it. So we take a different attitude. We go, I can't make you stop crying, but I can give you what you need, a little bit of soothing. I can tell you everything's okay. This is the attitude you bring to your brain. I can't make you stop crying, sending these signals to the body. I can give you what you need, though, a little soothing, even though I can't change you right now. This is the autonomic nervous system. I don't have direct control over it, but I can start training it that there's a different way to deal with all. When this is happening, I can calm down. I can step back and say, oh, I see you're getting excited, trying to protect me. Thanks for trying to protect me. Don't need it right now. But we do this with a set of tools that doesn't involve just saying, I'm okay, I'm okay, I'm okay. You say, I'm okay, and your primitive brain hears this. It doesn't speak English. It's a freaking lizard. It speaks body language. So we use a different set of tools to access this part of the brain, set of tools that involve some very basic body awareness to start teaching it that the body is actually a safe place and get it out of the vicious cycle of tension comes in and the brain goes, oh crap, not that again. We got to get it out of that cycle. I don't know.
I've heard it explained another way too, which is the circuitry in your body is like a trail or a path that you've become habituated to. You've followed it and it's become entrenched or ingrained in your mind. So anytime you have this tension or these subconscious thoughts, that's where it hits. It hits the knee, it hits the ankle, it hits the shoulder, it hits the headache or the back pain, because that's the pathway that you've ridden so many times that's just what happens. But to retrain your brain, you have to start riding a different path. You have to stop going down that same path. And it takes a while because, it's like a rut. Your tires keep going back in that rut and wants to follow that. But to try to go back that new pathway. And it's always there if you'll just notice it and stop letting your mind just take over.
Mhm.
I thought that was another way that was helpful for me when I was trying to heal, because again, the pain was always there and it would stop. But then I would notice, here's back again, how bad it's going to be. Am I going to sleep tonight? You know, I can't sit still. I couldn't golf. I had to lay down on the golf course. I couldn't go watch my kids play sports because I'd have to lay down in the field. I mean, it was just one of those things where I told myself over and over, I have a disease, and it was something I could not move away from. I couldn't get into this different mindset. Took a long time, but the path now is gone. I mean, I have zero pain. I have no diseases, which I was labeled with. And it's just such a nice feeling to know that I have power.
I feel
Yeah.
like language is such a powerful component when it comes to healing, because you can say, I can't, I won't, I'll never get better. I'm always going to be like this. And this is, I'm going to be the victim of it. And this is just my label. This is my diagnosis. This is just my lot in life. Right. And I teach people language is everything. And they're like, I hope I get better. I'm like, no, you don't hope. You'd say, I will. I will,
Right.
like I can, and I will, and I'm going to.
Right.
And I I speak this way with our kids. They're like, I hope I hit a home run. I hope I get on base. I'm like, no, you can and you will. And
Right.
whatever your mind believes is what is going to be what comes out. And you can or you can't. And that's your decision. And that's a big part of healing. That neurocircuitry in the brain is your language, and in your focus. Are you focusing on what you can or what you can't control? Are you focusing on the past, the present, or the future? How's that working out for you? Um, there's just so many key components that create this neurocircuitry that you can take the super highway of taking pain medication and always being in pain and accepting your diagnosis, or you can take the bumpy road, and create a new rut for yourself. And that's going to become your new superhighway because you've gone down it enough, you've trusted it enough, you can get from point A to point B, and then your old superhighway just crumbles away because you don't need it anymore. And you've built trust in this new, better direction that is actually, lifts your spirits, takes your pain away, and
The power
creates a
of
better
belief.
life.
It is placebo and nocebo. I mean, I don't think we can overstate those two components of the mind. Is what you believe, what you're told, if you believe in good things and good outcomes, or if you believe in bad things and bad outcomes. Do you have any comments on that, Dr. Fanestil?
Well, I think I'm hopeful for a world where we don't need as many people who are spreading this word like Heather is or like I am, because it will become just our new understanding about how our brain and body are connected. I have a little sheet that I show when I'm talking to physical therapists called Sticks and Stones. And it has one column here that says words to avoid, and over here, alternatives. So, instead of degenerative changes, you can say normal age-related changes, because all bodies degenerate with age. That's just how it is. And there's nobody has a spine at age 50 that looks like it did when you were 10. That just doesn't happen. Instead of saying instability, you can say needs more strength and control. Instead of bone on bone, you can say narrowing. All sorts of things. Instead of damage, you can say repairable harm. You can say also, there's all sorts of, so I've got this long list of things, but so this idea that language makes a difference, and it's a super important point, and it's difficult when you are the only person using this language, and then the person goes back to their doctor who uses these other terms.
Yeah.
So I'm hopeful for a day where everybody kind of gets this and is using this.
Yes. Can you say more about maybe people in the boomer era, if you will, that are starting to see all this degeneration in their bodies, whether that's hips or shoulders or knee replacements? I see this so often, and maybe you can shed some light for people who might be walking this path and feeling like they need a surgery. I know you've shown a lot of studies on your YouTube channels about what's normal and as far as aging goes, as far as MRIs are shown. Maybe you could shed some light for those people who might be experiencing those problems.
Yeah, and this can be a nuanced discussion because we all age and we all, again, all degenerate. I'm 65. My low back doesn't feel like it did when I was 40. I get stiffness there that I never got when I was in my 40s. The difference is, or I think I have, I don't know this for sure. It's like asking somebody else, do you see the same thing when you say the color red? I don't know if they're really seeing the exact same thing. We've agreed to call whatever they're seeing, right? But so my back, but I know, I'm convinced that if I told myself, oh my God, oh, there goes my back. Oh, geez, I'm getting old. That's different than, oh yeah, oh, there's my back. My SI joints probably what they weren't what they used to be. So there's some acceptance that comes with aging. And if you're not 65, you may be going, well, that's not going to happen to me. Come back and talk to me when you're 65. Stuff happens in everybody, but your approach to it is important. And again, I'm not saying ignore the real things can happen. I mean, you can get real damage. The question is if it happened slowly and over, the human body is an amazing healing machine. That's true even as we age. And so when it happens gradually over time, your body usually accommodates for these things. And I have a guy, he's a friend of mine actually, and when he and I were talking about this several years ago when I first started going down this path, and he's a little older than I am. He's probably 68 or 70 now. I'm 65. And he said, before we started talking about this, I was this close to hip surgery. He's a hiker. He gets out. He's a runner still. He's like, I just couldn't do it. And then we started talking about this. That was 3 years ago. I'm not even close to hip surgery now. Are you kidding? Do I feel this right hip a little more than my left one after a hike or something? Yeah. So what? It doesn't keep me from doing it though. It used to keep me from doing it. And it used to make me miserable after the hike. And now it doesn't. So I do think that even that when I say it's a nuanced discussion, we're not trying to BS your brain here. That, oh yeah, your hips are 30 years old. No, they're not. But the key message here is the part of the brain that runs the body cares about one thing and only one thing. Is the body safe? Am I under any threat right now physically? It's the lizard brain. Lizards don't have other concerns about existential worries, their mortgages or their rent payment or their relationships. Lizards don't have those things. It's just, is the body safe? This is the part of the brain we're dealing with. And it's not BSing your brain to say, oh, my hip feels different than it did, and I'm okay. I'm all right. And start delivering these messages. So when you ask about as people age, I want to say it's a nuanced discussion, meaning there is some level of acceptance. Although I have to say 40s and 50s, usually it's 99% what I call neuroplastic stuff. Not always. It's important to look at what's going on. But, the last thing I'll say about that, or I have other things, but one more point. I'm so old that I work with a lot of World War II vets at a VA hospital in Los Angeles. These guys were in their 70s now, in the late 80s, 90s, when I was in medical school and residency. And these guys would come in with all sorts of crap. Shrapnel up against their spinal cord. That should have been removed right away. Should have got rid of it. Who knows what that's going to do to your spinal cord? Or bones that didn't get set properly. And now their leg is crooked. And it's crooked forever now because the bone healed in an incorrect position. They're walking with a limp because their leg is freaking shaped not right. Pain? No. So you can have all sorts of abnormalities, whether they cause pain or not. And probably this guy's leg is stiff. He's like, yeah, it's a little stiff in the morning. I just tell myself, thank God I'm alive. Reminds me that I'm alive. Or they have that, have that kind of attitude. And they do everything they need to do. So the fact that you can see something, whether it's on imaging, that is not like, oh, I have a real problem. Well, we've all got real problems as we age. And again, without minimizing or taking away from how bad it's been, people are surprised to notice once you start dealing with, again, pain's a two-way street. Once you start treating the downward part of the pain circuit, it's amazing what can happen.
Mm-hmm. Well, they talk about psychosomatic issues, and that's where most of them come from. I want to get into most of the pain conditions come from is what I'm talking about. But I want to get into maybe your thoughts on the genetic factors a lot of people assume are the causes of their conditions. versus maybe what we call now epigenetics, because you've talked about neuroscience and kind of this new way of looking and exploring the world of science. And I know in Dr. Joe Dispenza's work, he does a lot of this epigenetics work and talking about how thoughts trigger new sets of genes or transform genes into, a new way of your composition of your body. Cells regenerate. Your body completely regenerates in a period of time. And I'm going to go back really quickly. This is why it's so important to me, is because I ask all my clients when I meet with them for financial planning. We go through their goals and their wishes and their financial issues and their money conditions now and their goals. And then we always have to ask this question: when are you going to die? When do you assume you're going to die? Should we use mortality tables? How do you feel? What's your health like? Well, my dad lived to be 75 and my grandpa lived to be 75. So I'm assuming I'm going to die about then. Or cancer runs in my family and, I'm pretty much expecting it. It's going to hit me sooner, pretty soon. And so I used to believe all that. And I want to hear your thoughts, because after experiencing all of what we've experienced, Heather and I, we've completely transformed the way we look at this. It's not passed down and your fate is determined when, you're made in the womb. It is determined by your thoughts and your thinking and your lifestyle and what you're doing in your life. So I try to change my clients' thinking around that. Not just get predetermined in when you're going to die. You're going to die at 70. You're done. So let's just spend all our money by 70. And then, whoops, you didn't die. So now what are we going to do? We've got to make your money last another 20 years, possibly.
Right.
What are your thoughts around that subject?
Yeah, I got so many thoughts. I'll talk about two of them. So the epigenetics thing is super real, super now well accepted. And there are any number of studies. One that I sort of keep in my head is a study done at Harvard back really before, I think this was around 2010, so quite some time ago. But anyway, took a bunch of people who were referred by their primary care doc to the Mass General Mind-Body Clinic. You mentioned Herbert Benson earlier. He's the founder of that clinic. He's a cardiothoracic surgeon who founded the Mass General, affiliated with Harvard Mind-Body Clinic. And anyway, these people were referred there because their primary care doc thought that their blood pressure, their asthma, or something might be helped by learning to calm their system down. And they said, "Hey, we're glad you're here. We want to teach you to meditate, and we want to do some blood tests before and after this 8-week little course you're going to take." And they drew some blood, and we mapped the human genome back in the 90s, and so now you can actually, every cell in your body has the exact same genes in the exact same DNA in the nucleus. But your liver cells look nothing like your skin cells, because your skin cells are using different genes than the liver cells use to produce different proteins and a different looking cell. But in the nucleus, the genes are all the same. It's just a matter of which ones are being used. So anyway, now you can map this. You can actually draw blood off of people, and you can take their white blood cells, pretty easy access to get your white blood cells, and you can map which genes are turned on and which genes aren't running in these white blood cells right now. And you can color code that, green for on and red for off. And anyway, so they do this, and then they say, "Hey, take this 8-week course on meditation. We're going to teach you once a week, and we would like you to do 10 minutes a day at home. And then after 8 weeks, let's measure your blood again." Hundreds of genes that used to be off turned on, hundreds of genes that used to be on turned off, all in the same direction. This wasn't a random change. All of these people, they all moved the same direction, and they all moved in the same direction as experienced meditators. So the idea that you can turn genes on and off with your mind, in this case, they were just testing simple basic meditation. This is nothing far-fetched. This has been proven over and over and over again, that the cells in your body produce different proteins, because that's what genes basically do. They encode for proteins, which are all a big bag of proteins. And so you can change that with your mind. Now, we can't change it down to, I want my white blood cells to have this gene on and that gene on. You can't do that yet. I don't know if we'll ever be able to. But accept the fact that we can't do it like that. And Western medicine says, well, if I don't know exactly which ones, I'm washing my hands of this. And I'm like, okay, wash your hands of it in the sense of agreeing that you can't block the right chemical, but don't wash your hands of it as a treatment for your patients. The evidence is overwhelming. Find somebody who knows what they're doing and help them do that. So epigenetics, super real, and very many things absolutely change in your body when you do so with your mind. This is not woo-woo stuff. This is just how brains work. Of course, you can change stuff in your body with your mind. The other thing I want to say, though, to when you're talking about your thinking can change. I absolutely agree with that. But I also want to make sure people understand there's a little bit of or there can be a little bit of a blame on people. Come on, just change your thinking. These circuits go way deeper than that. I was talking to my daughter once. My daughter's now 24, but I remember when she was 17, and I was just getting into this stuff and reading about how brains work and stuff. And I told her, how when you were like 2 and 3, from a very young age, you were like, we had to cut the tag out of the back of your shirt and the crease across your socks. You wouldn't wear shoes and socks. You've kind of always been like that. Then in 2nd grade, remember I got that phone call from the 2nd grade teacher, and she said, it's midwinter and your daughter is running around the playground in flip-flops. Can't you send her to school in boots? It's a snowy day. And I'm like, I sent her to school in boots. She had those in her bag. She just won't wear shoes. And then in middle school, you're a little bit OCD about your room and this, all that stuff. I've been reading about how brains work, and I don't know this, but I'm wondering, when you were in utero, this is her mom, my wife, when you were in utero, your mom's dad was dying of a brain tumor, and she was one of his big caregivers. And then when you were 4 months old, he died. And the next year, I can tell you, was full of grief for your mom. So I can tell you that the first 2 years of your brain development occurred in a hormonal milieu of cortisol and adrenaline. Maybe that's why you were kind of all like this. I don't know that. I don't think you need to go do an in the womb Reiki experience to figure it out either. I just think you need to accept the fact that what we now know about how brains develop is they develop in accord with their surroundings. And even at this very young age, maybe yours did this. So again, I don't think she needs to go psychotherapize herself about this, but she does need to, sometimes those kind of stories can help people understand that kind of story has changed my view of stress. For 30 years as a primary care doctor, people would come in and they said, I've been to Mayo Clinic and I've been to 13 doctors and I have this procedure and nobody can figure it out. And often at that point, especially if I had a relationship with them, I would say, you think there might be some stress related to this? And people are open to this a lot of the time, especially if you know them as a doctor. But I'd get this response. Well, I thought about that, but I'm getting to bed on time. I'm going for a walk every day. I'm eating pretty healthy. Now, 20 years ago, when my son was hooked on heroin, or I was going through a divorce, now that was stressful. But now my relationships are pretty good. My finances are pretty stable. And like I say, I'm taking care of myself. And my old response was, okay, good. Just wanted to make sure you got your stress. Okay, your stress level's covered. That's not how stress works. Stress could be something that happened to you 20 years ago, 80 years ago, that you don't even remember. Stress could be 15 years ago when you had cancer and you spent some time in a hospital and almost died in ICU once or something. I hope your brain got a little hypervigilant watching out for you during that time. And so these are just normal circuits that if you ran them very much, they're just on all the time. So this goes beyond just change your mindset. I think mindset's an important part of this, a very important part. I think the words we use are very important, but you can't just use the words if deep down your primitive brain thinks you're trying to BS it with these words. This is about changing things on a deeper level. And again, I like to say that if the captain of the ship, your cognitive brain, again, the words you use, very important. I like to say the captain of the ship doesn't get these concepts, the idea that you can change this. If the captain of the ship doesn't get this, your crew will never get it. But just the understanding about this concept, that's just step one. We have the intellectual understanding. Now we got to train this lower part of your brain. And this part of your brain doesn't learn by reading books and watching lectures. This part of your brain learns by experience and repetition, which is how my autonomic nervous system got the way mine is and how yours got the way yours is. A lifetime of experience. If we want to change it, we start giving it new experiences. Specifically, we give it experiences of safety, and specifically, we give it experiences of safety in the body. that my body's a safe place. But this all has to happen without BSing. And so many people I see that I've been working with these mind-body ideas, and I feel kind of stuck. I like them. I think they make sense, but I don't know, something's not working for me. Often the first question I ask in that regard is, what do you think is causing your back pain or your stomach problem or your headache? And often people will say, well, I've done the reading, I see how brains work, and I think my brain, and I think they might use the term neuroplastic, or I've got a mind-body thing, or I get that. And then I'll say, okay, so you think it's largely, at least, coming from your central nervous system and your brain. Are you able to say, so there's nothing really wrong with your back then? And they're like, yeah, that's what I believe. Nothing. Okay, go ahead and tell me. Can you say that to me? Oh yeah, I can say that. Nothing wrong with my back. Yeah, I can say it because I know where it's coming from. Yeah, I can. Well, go ahead. Yeah, I can do it. Okay, go ahead. And sometimes the tears come. Sometimes, and they'll say, "There's nothing wrong with my back." And I'm like, that doesn't sound very confident. So the getting better is because they can say the words, but it still feels like BS to them. And so those people need maybe a little more education, maybe need to maybe they need more studies. Maybe they haven't ruled out everything. But anyway, I guess I'm just getting at this idea that I like people to think, if you kind of got two parts of your brain, you got to train that intellectual part and get the concept. But we're going to use something other than just saying things with words that my lizard brain doesn't understand to get this better. We're going to go to the body, like you have your patients do. Where do you feel that in the body? It's not an intellectual exercise. It's not, and people have trouble getting past that. They're really good at using their intellect. And I'm like, we got to get out of engineering brain here. That's not what's going to solve this. There's a different part of your brain. You just have to accept there's a big part of your brain running you that's not intellectual. And you can grit your teeth through it, but you can't overpower it. This lower part of your brain has orders of magnitude more synapses, neural synapses, than your cognitive brain does. You can suck it up, but you're not going to overpower it. You can teach it though.
I see so many people that they're like, just tell me what to do and I'll do it.
Right.
Give me the directions, the recipe.
He was number one on that. Just tell me what to do and I'll do it, because I just want to get out of the pain. And what I have to say to that is, you can do all the actions in the world, but they will always realign with your core beliefs. So if you think you're not good enough, if you think, you have to be this way and that way to get love, you're setting yourself up for the same experience over and over. Your actions will always realign with your core beliefs. And for me, as far as epigenetics go, I was diagnosed with chronic fatigue. It was pretty severe. I had to pull over the side of the road with my kids in my car because I just needed to get my I just had to get my bearings for a minute. And I called my mom one day and I told her how I'm feeling. And she said, "Oh, honey, you have chronic fatigue like me." And from that point forward, it just spiraled out of control even worse. And I was like, oh, it's just genetics. This is just what I'm dealt with for my life. And then as soon as I understood, okay, there's a core belief behind the chronic fatigue, and the emotion associated with it is, I don't want to cope anymore. Raising these kids is hard. Blending a family is hard. Dealing with all these outside things that we're having to deal with is hard. Having all this responsibility is hard. And I didn't want to do it anymore. I just wanted to live in my own little world where I didn't have so much responsibility and I wasn't so overwhelmed. And I look at my mom, and she had 5 kids, and I'm experiencing the same emotions that she did once upon a time. And so it's not that it's genetic. She's not passing it down. We're perfectionists trying to survive, and our body's saying, I'm tired and I don't want to do this anymore. And so what is this belief system that you have, that you're never going to get through this, that you're never going to feel better? What is setting you up for your pain and your disease? What thoughts are you thinking that are going to keep you perpetually stuck? Because you can take all the action steps in the world. You can have all the surgeries, you can have all the pills, all of this and then that, see doctors and specialists your whole life, buy 100 new mattresses and think that they're just a quarter of an inch different on one side than the other. We've spent all the money, did all the things, but our core beliefs weren't changing. And that is what we really had to figure out. What are these core beliefs that are keeping me stuck in this pain cycle?
Yeah, super
Yeah.
important.
Yeah, it's a really important part of it. And gosh, I know that we've kept you a long time. I know you have to jump with another appointment here, but
Yeah.
we truly appreciate your thoughts,
Yes, thank you.
your
Well,
comments.
thank you guys for
This is
letting me.
so pervasive all over the world and all sorts of conditions, not only pain, but all sorts of anxiety and diseases and anything that's physical. So those of you who listen, I hope you enjoyed the show today. You can find more information on Dr. Fanestil on his website. We'll have that on your show notes of his Mind Body Clinic in Boulder. And I hope that you find information that you can share with your family or yourself if you're dealing with these conditions. So until next time, hang in there, folks. Talk to you later.
Thank you.
Thank you for listening. For more information about today's show, please check out the show notes. Visit our website at www.petersonws.com or give us a call at 801-475-4002. Peterson Wealth Services is a registered investment advisor. This is a paid-for advertisement. Information presented on this program is believed to be factual and up-to-date, but we do not guarantee its accuracy, and it should not be regarded as a complete analysis of the subjects discussed. Discussions and answers to questions do not involve the rendering of a personalized investment advice, but are limited to the dissemination of general information. A professional advisor should be consulted before implementing any of the options presented. Peterson Wealth Services.